Hi, my name is Koco Eaton, and I'm an orthopedic surgeon specializing in sports medicine in St. Petersburg, Florida. I went to medical school at Johns Hopkins University in Baltimore, Maryland. I did my undergraduate at Columbia University, where I played college basketball and first had an interest in sports medicine. I was fortunate enough to do my orthopedic residency at Union Memorial Hospital, and I did a sports medicine fellowship with Drs. Clancy and Drs. Andrews in Birmingham, Alabama, before coming to St. Petersburg, Florida. I've been fortunate enough to be involved with the Major League Baseball team here in St. Petersburg, the Tampa Bay Rays. Just this past baseball winter meeting, I received a 20-year service award for being involved with the baseball team. This past year, I started working with the Tampa Bay Buccaneers football team. So this is my first introduction into the NFL and taking care of football players. ACL surgery, what I've noticed that one of the rate limiting steps is preparing the bone graft after we take a bone tendon bone graft from the patella tendon. And always what happens is that we've got too much bone that has to fit into a 10-millimeter plug, round tunnel. So what we've done in the past is that we've taken an instrument called the rongeur, and we just whittle away at this bone plug till finally it's down small enough that we fit it inside a tube. The problem with this is it's never a perfect fit inside the tube. And bone that's particularly hard and brittle, we wind up taking away more bone than what's really needed. So I had the idea of setting up a bone block to be cut with a saw that could be held by a clamp. With an engineer, I developed this product, and I thought it was a unique tool for a sports medicine doctor to use to help facilitate the surgery. But truth be known, most sports medicine guys are handing off this part of the surgery to their physician assistant anyway. So even though it takes a while, it really doesn't slow them down that much if someone's doing a lot of ACLs. But I think the person who's really going to benefit from this device is the guy who does the occasional ACL surgery. After I developed this clamp, I had a scrub technician who was working with another orthopedic surgeon in town. He got to this part of the case. That scrub tech went to lunch, she had lunch, she came back, and he was still working on getting the bone block to fit into the tunnel. So he had spent 30 minutes whittling away trying to get an exact fit. Because he doesn't do a lot of ACLs, but he's a cautious and careful and conscientious surgeon, he was taking his time. This clamp will allow him to make an exact cut, to be conscientious, to be careful, but make him a lot more efficient. And so that's what I've developed here, is a bone clamp that can actually hold the bone graft in place while we make a cut straight across this top surface so we can have a measured cup every single time. The base of the clamp is a little bit more than 8 millimeters. The width of it through the top is actually 6 millimeters, and the depth along the side is also 8 millimeters. The diagonal across the clamp from this corner, lower inferior corner, to the superior high corner is 10 millimeters. So when the bone block fits in here, the diagonal measures 10 millimeters. And it's the diagonal that is the largest portion of the bone block, which always holds up the bone fitting nicely inside the tunnel. What's nice about this is that now we can have a reproducible bone block where we have the exact same size every single time fitting it to the tunnel. And it's done more quickly because we're using a handsaw, a blade, a high-speed blade where we can take off just millimeters of bone and shave it down and get an exact fit every single time. A large advantage of this clamp is it allows the surgeon to do the ACL surgery through a much smaller incision. This clamp allows you to prepare one end of the bone graft, and with this, you can then pull and retract the patella inferiorly and retract the skin superiorly so that the patient has a very small incision that sometimes can be an inch or less, even though we're using bone, tendon, bone from the kneecap tendon. Now, in guys, no one cares about our knees. We have hairy legs. No one's looking at our knees. But there's a lot of women who tear their ACLs playing very active, aggressive sports. And even though they're active and aggressive in sports, we still look at their knees. And if you can barely see a 1-inch incision, that patient's going to be a lot happier. And what I say is that I want the third ACL off the soccer team. The first ACL comes to me, she gets a small incision. Second ACL goes to one of my competitors, they have a 3-inch incision. That third patient sees both of them doing equally well. All things being considered, is going to come to me for the smaller incision, more cosmetic, and a quicker recovery. So that's the reason why I went ahead and developed this clamp on my own, independent of equipment companies, so that surgeons can have this tool to use that's reproducible and will make us more efficient as ACL surgeons for that very difficult part of the case.